3 years ago, a 63-year-old female who was suffering from extreme obesity presented to my office with bilateral knee pain. She had only been working for the current employer for about 4 months and was working as a CNA, which required her to stand on her feet for 8 hours or more per day. On the clinical exam, it was quite obvious that she was in pain as she was limping. Both of her knees were swollen and she had decreased range of motion. X-rays obtained at that time revealed advanced severe degenerative arthritis of her knees bilaterally. That finding would support that her chronic knee pain had been there for many months and most likely predated her employment with the current employer. I immediately notified the employer as well as the workers' compensation carrier that I felt that this was a pre-existing non-industrial condition. The patient was told to go back and see her Kaiser physician for treatment of her chronic knee pain, as she clearly most likely needed a total knee replacement. The patient did not keep any further appointments in our office and was not seen until 3 years later when she presented for purposes of preoperative clearance. At this point in time, she had seen an orthopedic surgeon through workers' compensation and was being scheduled to get her knees replaced. I immediately called the workers' compensation carrier and identified the fact that I had reviewed private medical records from Kaiser 3 years prior, which showed that she had pre-existing non-industrial degenerative arthritis of her knees. And even at that time, the Kaiser orthopedist had suggested that she would need a knee replacement. Obviously, those medical records were not provided to her current medical provider at Kaiser, and the patient clearly knew that this was a pre-existing non-industrial condition. I applied the CARES philosophy to this claim in communicating effectively with both the employer, the workers' compensation carrier, and the patient. I applied the ACOEM guidelines with respect to the proper treatment for someone with advanced degenerative arthritis of the knee. I developed rapport and a good relationship with both the employer, the workers' compensation adjuster, as well as the patient to hold her hand and make her understand that yes, she needed a total knee replacement, but it needed to be done on a private medical basis. I even provided her with a copy of her own medical records from Kaiser, which showed that before she even began employment with this employer, she had been told that she needed a knee replacement. It's no wonder that employers stay with us for a long time because we make a diligent effort to treat patients properly and professionally, hold their hand through the process, get all parties communicating, and get the patient taken care of in a proper manner. I gave the patient a copy of my business card and told her to go back to her Kaiser physician, and if he or she had any questions, I'd be happy to talk to them. The patient was satisfied with the care. She never got legal representation, and she went about getting her knees replaced on a private medical basis through Kaiser, which is what she should have done in the first place.